Hello, I'm Tony DeMaria, the editor of JACC, and I'm here for another session of the Genuine article where we discuss one of the really interesting papers that we've recently or are about to publish in JACC. And I'm here with Deputy Editor Ori Ben-Yehuda and with Dick Conti from the University of Florida, who served as a reviewer for this particular manuscript. And the manuscript itself deals with the interesting topic of coronary spasm and the treatment of coronary spasm with not only calcium channel blocker drugs, but with statins. And it comes from a multi-center study that was performed in Japan, headed by Dr. Yasui, who's very well known in coronary spasm. So, Ori, perhaps I could begin with you and ask you to describe the specific study.
So as you mentioned, this paper comes from Japan, where a lot of the literature on coronary spasm comes from, an area that I think we've not delved a lot into in this country and is of great interest. As is known, coronary spasm is treated mainly with calcium channel blockers, but data suggests that endothelial dysfunction occurs in coronary spasm, and endothelial dysfunction is affected by statin therapy. So in this study, a group of patients with documented coronary spasm were continued on calcium channel blockers, but were then randomized in an open-label design to fluvastatin versus no statin. After 6 months, coronary angiography was repeated, and indeed coronary spasm had been diagnosed in these patients with acetylcholine provocation. And what the authors find is that after 6 months on repeat angiography and acetylcholine provocation, there was a significant decrease in the number of patients in whom they were able to demonstrate coronary spasm. Of note, they actually withdrew calcium channel blockade 48 hours prior to the provocation, so this effect appeared to be directly as a result of statin therapy and did not require the presence of calcium channel blockers during the provocation.
So the interesting findings here are using acetylcholine provocation as the marker of coronary spasm, that the addition of a statin to a calcium channel blocker actually reduced the ability to provoke spasm in a substantial number of patients, likely due to the effect on endothelial function. Now, no paper is perfect, Dick. Each paper has values and limitations. And as a reviewer, what did you like about this, and what were some of the issues you saw?
Well, first of all, it was a very cleanly written paper, easy to understand. The experiment was very clean, as Uri said. I guess the limitation would be the numbers of patients in the study, 30 and 30, and the follow-up, which was, I believe, 6 months. The other thing is, it's sort of interesting that I would have liked to have seen them try other statins. We all know that statins have pleomorphic effects, and maybe one has more than the other. That may be in the works for them, as far as I know, but I don't know that for sure. The other point is related to an issue that I've seen now over the many years. I've known Hirofumi Yasu since 1978, and he's been involved in this investigation. We rarely see coronary spasm anymore, and I wonder if it has to do with the fact that all of us are using statins in patients who have any semblance of ischemic heart disease.
Interesting. Maybe that our widespread use of statins is eliminating spasm. Let me ask either one of you, is acetylcholine provocation of spasm the same as the clinical occurrence of chest pain and ECG changes?
Well, we've done it at our institution. We've used ergometrine, ergonovine, and acetylcholine, and they seem to be interchangeable, and they do produce the clinical syndrome of ST segment elevation, usually chest pain associated with it. So I'm pretty happy with that.
It seemed to me that they didn't comment that the patients had clinical pain and ECG changes with their acetylcholine challenge, did they, Ori?
No, they didn't, but the patients did have a clinical syndrome consistent with vasospastic angina.
And they had improvement clinically, I believe, with the statins as well.
That is correct. Again, this was an open-label study, so we obviously always prefer placebo-controlled, but this really does raise an important issue, I think, both in terms of are we overlooking spasm as an important clinical entity. Obviously, it appears to have greater incidence in Japan, but still may be of relevance to all of our patients. And in addition, the importance of statin treatment. And I think we still need to have further investigation as to whether this is all a pleiotropic effects or related directly to LDL lowering.
Right. Well, even in Japan, where, as you said, spasm seems to be a bit more prevalent, they had to gather a multi-center group of investigators to identify enough patients for this study. Very interesting, but I think clearly a demonstration that adding statins to calcium channel blockers may well be beneficial for our patients with coronary spasm. The pure spasm syndrome, or perhaps even as Dr. Ben-Yehuda says, stable angina pectoris. Thanks very much for viewing this, and we look forward to presenting another one of our interesting papers in a soon-to-come Genuine Article session.